All right.
Okay.
Hi, everybody. So we are going to go through the steps from for making a treatment plan from the notes, the chart notes from the exam, all the way through to the treatment plan. So we have our test patient here, and we've got the notes in. So I made some notes here that these were the treatment needs. So number 28, a root canal buildup and crown, the reason why it is needing what we recommended for each tooth. So then once this is in your chart notes, make sure over here that it says chart note and save the note. And then we're also going to come up here to chart for the odontogram or the tooth chart. And then we're going to put in the treatment that is recommended. So what I'm going to do is I'm going to pull this back up so I can see it and pull the chart up here. So we have number 28 is recommended for a root canal, a buildup and crown. And we will be doing the root canal here. We're not referring that, so we will make that into our treatment plan. So we're gonna come over here and we're gonna put root canal therapy. Dr. Davis is the provider that will be doing that treatment, so we'll do it there. And it is proposed, so we click OK. And then we're gonna go back to the tooth. We see it in red, there's a root canal recommended there. Click number 28 again. We're going to come back over here right above it where it says crown and buildup. That is an exploding code, so we're going to go ahead and click that because it's going to give us everything that we need. So we've got the porcelain crown. Dr. Davis is the provider. We've got the buildup that is recommended. And then also the PA that most insurances would like to have, plus it's just good so that we can make sure the crown's seated and everything's good there. And then the seat of that crown as well. So now it's showing in red that there is a crown, a buildup, and the root canal needed there. So then the next tooth in our chart notes is number 12, MOD composite. So we're going to come up here to number 12. And then come over, because it is a posterior tooth, we're gonna do the composite P. So we have composite A for anterior, composite P for posterior. So we're gonna click that. Still Dr. Davis as the provider. It is proposed. It's a mesial, occlusal, distal. So we click the surfaces, click OK. And now our MOD is in the notes, or in the chart. So then the next tooth is number 14, DO composite. We're going to click 14. Again, it's a posterior tooth. Click composite P. We're going to click D, distal occlusal for our DO, and OK. And then the last tooth was number 3, buildup and crown. So we're going to come up here and click number 3. Again, come over here to crown, buildup, and go through that again. So the crown, the buildup, the PA, and the seat of that crown. And then we're going to come down to save and click save. Then from here, we're going to TX plan. We can click it here, or if you're not in this screen, you can also, where you see this TX at the top up here on the bar, that is also a way to get to the treatment plan. But you can't open this from this icon if this is open. So if it ever pops up and says that it's open and no one else is in the chart except you, make sure that you don't have this open as well. But we're going to go ahead and go in from the chart. So we're going to do TX plan for the treatment plan. I'm going to make this bigger so we can see that better. Okay, So first thing we're going to do is we're going to click View All Items, regardless of what's in there. Just click View All Items. You're going to come to the very bottom of the screen where it says Recalc Fees. And this is going to make sure that we update all the fees and everything is correct with their remaining benefits, as well as any fee changes or anything like that. So you click it. Sometimes I click it 2 or 3 times to make sure. Then we come up here to the upper right and click Process. So this screen's going to come up. You don't want to print yet, so don't click here. You're only going to click OK. That's going to process those recalced fees to make sure that that is correct. So now we're going to click Treatment Plan again. Any alerts? Okay. And so now, if your patient does not have a treatment plan already existing, a little thing will pop up on the screen that says, no treatment plans exist. Do you want to continue? You would click yes. If not, if they've had one in the past, then you're just going to come over here to these buttons here, and we're going to go to New Plan. So we click New Plan, and we're going to make a description. So we'll put in the date, and then depending on what it is, if you have a single tooth, you can put that one. I'm just going to put restorative treatment. You can also put perio treatment if it's for SRPs and things like that as well. So this is restorative. There's more than one tooth, so we're going to name it that and click OK. So here's the list of everything that is proposed on the patient's chart. So we're pretty much wanting everything on here except the seats. We don't put those on there because there's no charge to the patient for the seat. So I'm going to not do those. But for now, let's just go up here where it says Plan Services. Click this little box right here. It's going to highlight everything instead of going through and clicking everything when you've got more than 1 or 2 things. Then I'm going to take Seat. I'm going to unclick that one because I don't want it on the treatment plan, and the seat here. You can put it on there, but it's just extra stuff that can confuse the patient. So then we're going to come down to the bottom where it says Use Selected Plan Services. We're going to click here. So now this is our treatment plan. So we can see we're on View Items by Plan. The description, we named it, the date, and the type of what was in the plan or what type of plan we want to name it as. We have the service codes, the provider, the number tag here, number sign, that is the order that we're going to put these in. So that way the patient sees in steps from what either the patient has as a priority or what the doctor has recommended as a priority. So we're going to go through the root canal and crown. Let's go back to the notes real quick so we can make sure that we're putting them in the right order. And so right here where it says patient notes, we're just going to click that, bring us back to the notes. These are the notes we just made. We're going to come back down. So I had listed that number 28 was our first treatment recommended because it's deep decay and it's bothering the patient. So that will be our first one. And then the others are just the 2 fillings are in numerical order, and then number 3's last. So you can go through that way and know how to order them. So now we're going to go back to our treatment plan. So I'm going to come down here on this bottom taskbar because that's going to pull up everything that we've been looking at. And we're going to come right over here to where it says treatment plan. So that way it pulls my screen back up. All right, so we have our root canal. We can slide over here. It's tooth number 28. So you can see 28's listed all right here. So we're going to click that number area, and we're just going to go through. That is number 1, 1, 1, and 1. So that is for the full treatment of that tooth. So then the next one, we can see it says resin post 3 surface. So that's our posterior composite on number 12. And then we're gonna, it's already there, so we're just gonna go ahead and number that number 2. And usually, because both teeth are in the same quadrant, if the patient's able to, you can do them at the same time. So we'll go ahead and group them together by the quadrant. So number 14 is also going to be phase number 2. And then our final crown for tooth number 3 is here. So we're going to go ahead and make that phase 3 all the way through. So now we have our phases. Sometimes they may be kind of in different orders, but you want them to be in numerical order like this. Just come up here and click this hashtag and it will make sure that they are all in order. So you just click it once. If you click it again, it'll invert them. Just click it back and it'll put them back into that numerical order that we want. So now that that treatment plan is made, we're gonna come right up here and we're gonna click process. So then this box comes up again. This time we are going to click print treatment plan. And then you can see there's some plans in here. So if you come across this, you want to go to the one that we just named, which is down here at the bottom. Our date, the restorative treatment plan, that's what we want to print. And then highlight it, come up here, click OK. And it has now printed the treatment plan. And then we ask front desk to review that to make sure that insurance and everything is correct on that. Again, it's always an estimate. Make sure that you tell the patient that. But we want to try to get everything as close as possible for the patient so that there are no surprises. But that way it should be printed out, they'll check it, and then that way you can review it with the patient.